The Center for Criminal Justice Research was started in 1991 as a vehicle for promoting and supporting the research of the faculty. The work of the faculty here centers around evidence-based practice. We also always have an eye toward developing policies, techniques, and promoting research in the field so that it can be applied in a very practical way to help the criminal justice system. For example, several years ago we created the Corrections Institute and the Policing Institute. Both of these entities are designed to take the research that's been done and to translate that research into practice. And so we work with agencies all over the country in how to better understand and better effectively fight crime, deal with offenders, rehabilitate offenders, and hopefully make the system a better and more just one.
The Corrections Institute is very unique because we are interested in advancing the field, and what that means for us is taking the most current results of research, both from research that's conducted by faculty members at the University of Cincinnati, but also a variety of other academics in the field, and then developing the materials and the trainings and the technology that agencies would need in order to put that knowledge into practice.
I am the project director for a national drug court study, and I also do systems level evaluations, so evaluations for county and city community supervision agencies. For the National Drug Court Study, we're trying to look at the effective elements of juvenile drug courts and how they can be incorporated into drug courts across the country, but we're really hoping that what we find can be incorporated into the everyday practice of juvenile drug courts, most importantly, using and incorporating evidence-based practices into their work with juvenile offenders. For systems level evaluations, we've done several across the country, and we're really looking for a shift in how they're working with offenders, specifically if they're going to be able to incorporate evidence-based practices, and that's really what our recommendations aim for in hopes of reducing recidivism rates for offender populations.
What we're looking at is trying to predict the likelihood of someone getting in trouble again. Corrections Institute has adopted or developed two different risk assessment tools, one for juveniles and one for adults. So we have the Ohio Risk Assessment System and the Ohio Youth Assessment System to help make decisions about offenders, determine where they need to go, what needs they need to be addressed, and then also to help providers deliver effective interventions for those offenders. Risk assessment tools it's a unique opportunity to provide a very high intensive training for end users. And so what we do is we actually have folks come in for a 2-day training, and we do a lot of hands-on video practice so that they are able to score the instruments out in a controlled setting. And then we certify every end user to ensure that when they go back to their office, they're able to do them effectively and appropriately.
Our program redesign projects are really about going into programs to identify the things that they do that's effective and the things that they do that's not particularly effective in helping the offenders leave and be able to manage themselves in the community without engaging in crime. So we go in and we help them redesign the program to be consistent with evidence-based practices. We are going to teach you a skill that we think might help you. It's really about making the programs more effective and making what's happening within the correctional programs consistent with what the evidence shows to help offenders come out and not engage in criminal behavior.
Effective Practices in Community Supervision is a community supervision model designed to help probation and parole officers become agents of change. Effective Practices in Community Supervision works to help probation and parole officers target higher risk offenders, target their criminogenic needs, and use cognitive behavioral interventions so that by changing their thinking we can change their behavior.
When you get angry, what happens?
River City Correctional Center is a community-based correctional facility. All of our residents are referred to by judges, and we're behavior modification, and the residents usually stay from 4 to 6 months. University of Cincinnati's been a consultant role and provided good training for us, applying the thinking for a change skills and how to teach it for their study on cognitive behavior therapy. The impact and the benefits I'm seeing are the residents are practicing the skills with the other residents. For instance, if they're in the dining hall and someone steals one of their food, they'll use the stop and think and get out of the situation without negative consequences.
I think what makes the University of Cincinnati's programs unique is that we not only conduct research, we not only publish as faculty, but we work with agencies. We go out in the field. We believe in cutting edge work. We develop new techniques, new curriculums, new programs. We promote them, we train, we coach. I think all of that together helps make us a very unique place.